Hey, I'm Jason Pozner from Boca Raton, Florida, and welcome to another No Spin Live episode via the Plastic Surgery channel. We have two world-renowned experts here. We have Kristi Hustak from Houston, Texas. Say hi, Kristi. Nice to see you again.
Hey, you too.
I'm going to be in your neighborhood in a couple of weeks, I said, for some Seitan stuff.
Yeah, can't wait.
Looking forward to seeing you. And our newest PSC member, Renee Burke from the suburbs of Chicago. Finally, you got dug out of the ice there. It's probably warm weather there now, right?
Yes, happy to be here.
Yeah. So this is your first one, so we'll take it easy on you, okay? Hopefully we have many more. So, we have two good stories for you guys, and one of them is sort of a rehash of a story that we have played a few times since COVID started, but there was some recent news story about the Zoom face and how people are finally getting out in the world now. And basically the story was, well, when COVID first kind of lifted us and where people came back in the office, we did certain things, but now it's been a year into it. How has the Zoom face changed your practice? Are you seeing the trends continue? And what do you foresee happening? So Kristi, you are the experienced person, so you're up first.
All right, so we are taking it easy on Renee, I see, right?
Yeah. We'll hit her on the next one.
Yeah, no. The Zoom boom, right? It's a real phenomenon, and quite honestly, I think all of us thought that COVID would be over, right? That this whole surge we're getting, and here we are, over a year into it, and we're still seeing numbers spiking. I think some people have started to go back to work a little bit more, and some areas are lightening some of the mask restrictions, but a lot of these things are lingering, and I think because of that, we're just continuing to see spikes in surgical, non-surgical approaches. In the beginning, it was surgery for me anyways. I think my non-surgical stuff really fell off. And I think now that that's coming back around, people are getting their maintenance again. And kind of, I'm seeing my Botox numbers and all my non-surgical stuff go up, just like pre-COVID, but with higher numbers. So I think my spectrums of surgical, non-surgical is still growing exponentially comparatively, but I do think that it's getting back to a little bit more normal spread. We're doing a lot more kind of maintenance stuff, lasers. We're getting back into the swing of things, I think, just at a higher capacity. What are you seeing, Renee?
Renee, what do you think? And then we'll ask you guys some questions.
Well, it's really interesting in my practice. When I came back to really big combined procedures. Everybody wanted to get it all done at once. They thought this was their only chance for downtime. And I thought, summer's going to come around. I'll have time for just the 1 hour, the breast augs, take a little break in between surgeries. And I'm not seeing that. I'm still seeing people wanting to combine big surgeries, kind of get everything in while they can. And now it's more, I'm just getting ready to get back out there, and like Chicago, they just opened up the city, or they're opening up June 11th. So, people they're going back out to eat, they're going on vacation, and this hasn't sort of stopped them from getting ready for that trend.
Have you seen more facial stuff now, like with the mask and people on Zoom? That was like the question. Like, we're getting a ton of like neck stuff, like a lot of faces, a lot of eyes, a lot of lasers.
Yeah, lasers, eyes, and necks. I think, that kind of, bending your neck down, doing virtual stuff. The fact that you're only seeing your eyes, definitely I'm seeing a lot of that. For sure.
Yeah, I feel eyes picked up so much. Yeah. I mean, it just skyrocketed, but it's the areas even that you're not seeing on Zoom that I think people are just looking at themselves more carefully as well. That they're wanting to combine with the facial things, but eyes for sure. And
then if you look at a lot of these stories, they always have a lot of facial plastics in the stories, and obviously they're just talking about noses and faces and stuff. But when they a lot of times they don't talk to us who do everything, and I'm like, it's not just face. There's like a ton of body stuff. Everybody gets a lot of stuff.
Right.
Yeah, because you're neck down, like
everything.
Yeah, absolutely.
I think we're busy across the board.
Yeah, and I think people are watching more. I mean, I don't know if they just have more time to be on their computers, but they're looking at trends more. People are coming and asking for every hot trend. They want this fox eye, they want the buccal fat, they want whatever they're seeing sort of the supermodels out there doing. So they're really kind of picking up on what seem to be sort of trendier procedures that may have waned in the past and are kind of waxing again. So,
and do you think that people are being more savvy? I'm getting a lot more savvy questions, really in depth, and like you say, Renee, that may be because people are doing their research to a different degree than they used to. So I'm getting a lot of really in depth. No, I want that blef trans conj because you won't make an incision, and what will that do for an ectropion? They're throwing these words out there, and I'm like, oh my gosh,
right.
This stay-at-home mom has gotten really savvy over here. Yeah. So I don't know. I think that's interesting too.
I always call them out though. Like I always get them. They come in. They go, I don't want a full facelift. Like, I go, what's that mean? They look at me, I don't know what that means. Like they're always throwing these terms out at me, and I really get to them. I'm like, listen, we're going to talk about what each of these procedures does, so when you're talking to your friends, you can be educated and you can educate them.
I know. Yeah. I think there's so much marketing with labels, especially abdominoplasty. Like, I'll tell them, well, you tell me if it's how long is it a mini, or how long is it a, and are you willing to accept a smaller scar with, bunching outside of it? No, and neither am I. We're going to do the perfect abdominoplasty for you. Like, I don't care how we phrase it. It is marketing.
Yeah. I mean, I think this gets back to credibility of the doctors. Like, really do your homework, go to credible doctors who are not going to double talk you. And I like Kristi mentioned, all this marketing crap.
Yes. Yeah. And I found too, I have more and more patients coming in that they have, their own Instagram channel, or they're going in and they're doing social media all about their experience, and people are writing more reviews. So more people are trying to then go out and educate, because I feel like they feel like they're an expert because they had the procedure done. Right. Which is good and bad, but
it's like the friends. Everyone's got the friend. My friend had laser. Like, when did your friend had laser? Like 1997 when they first came out. You know what I tell everyone a lot is I use a lot of iPhone analogies. When they ask me about a technology that I think is old, I go, that's iPhone 2. I'm on iPhone 12.
That's brilliant.
They all get it. They get that, because a lot of times people are trying to sell them stuff that we threw in the garbage years ago.
Right. Or laser didn't work on me. I already tried
that.
Exactly.
What was it? Did you have like a Clear and Brilliant, which is a 2% density that the esthetician does, or did I burn your face off? You took 3. All right. I think
iPhone 2.
I think we beat this one down. So kind of let's go to the next story, and we're going to start out with Renee. And so Renee, I know that you spend all your waking hours watching all of this Bravo TV, right? I know
every minute.
Are you so my significant other, she loves, and I have to admit that I know some of the characters because I'm sitting on my iPad reading a book in bed, and she's got a bunch of people yelling at her in the background. So let's talk about 90 Day Fiancé, because something got my goat on this, where Angela from 90 Day Fiancé, she had a gastric sleeve and she had a breast reduction same time, and she was smoking, and now she wants a facelift. And Renee, you're going to talk about this, and then Kristi, and then I'll be up. So what do you think about this?
It's absolutely ridiculous. And I think it really portrays unrealistic expectations to people watching this. They think they can come in and dictate. Like, I have to admit, they showed me clips in the OR when you said we were going to talk about this, because I had no idea who she was. But they said, where she said, I'm not going to take that test. You're not going to make me take that nicotine test. That you could come in to talk to me like that. I would say, that's fine. You can walk away, and you know what the financial policy is. So you don't need to take it. But we test at the pre-op, we test on the day of surgery, and there are signed sheets and forms, because I don't want your complication and you don't want your complication. It's irresponsible, in my opinion.
Right. So, and what do you think about getting the gastric sleeve at the same time as a breast reduction? Forget the smoking. I never heard of that. You're fat and you're going to have fat boobs, and then you're going to lose weight after you had reduction. I don't get that.
Yeah, I mean, I guess it in some ways, big breasts, and we've all had women who were tiny itty bitties but had massive breasts, right? So could these be non-responsive to weight changes? Sure. That doesn't mean your skin envelope's not going to change, though. So I guess that would be a conversation that this is going to shift when you have you're going to have a skin envelope that's going to be flappy again, and you're going to need a lift revision to some degree. Absolutely. So, I mean, could her breasts been so inhibitory that she needed this from a quality of life standpoint? I mean, maybe. I don't think that was the case in this, but certainly the right idea is you lose your weight, you're stable for 6 months, you're 18 months post gastric bypass or sleeve, right? These are standard rules that we all follow by, because if you don't have stable weight for 6 months, things are going to shift. So why would we want to operate on you twice? And let alone the smoker, you're just a bad surgical candidate, and that's a bad doctor. But you know.
And then what about the facelift? If someone just had a gastric bypass, I wait till they lose their weight first, so I can do the best job and do it once, not do it and then lose your weight and then do it again because you sagged.
Face is different in my book. Yeah, that's not different than breast for sure.
I mean, but even with breast and face, that skin gets loose. It's poor quality. I mean, you see some of those women who come in and they tell you, I'm wearing a D cup. It's just sagging skin that you can pinch between two fingers that just the skin fills in a bra size. Well, it's the same thing sometimes with the face and the neck after you had that huge turkey waddle. Now it's just hanging skin. I mean, and you would have that skin if you did her facelift at the time of her gastric bypass.
Absolutely.
Just basically like stupid, right? This is stupid TV stuff that like the first doctor that did the surgery, did the breast reduction while she was a smoker at the time of the gastric bypass. I'm going to give him 2 thumbs down.
That just wasn't smart. Oh,
right?
Yeah, 2 thumbs down. Yes.
The facial plastic who decided not to operate it on her because she was a smoker, I give him a thumbs up, but I give him a thumbs down for not at least talking about the weight loss at all.
Absolutely.
Yeah. So I'm not crazy, right? You guys agree with me on this?
No, that's just not good medicine for sure. Yeah. But maybe it's better TV. I don't know.
Yeah, I think so. I think you guys need to watch some more, Bravo TV. You guys are missing out.
Okay, you come babysit my 5 and 7-year-old. I'll watch Bravo. It's a deal.
I'm on my iPad. It's pretty bad that I actually know these characters. I just don't understand the housewife shows because I've done a couple of them and I know they're fun. They're nice to talk to, but they're yelling. I don't want yelling. I would have stuck with my ex-wife if I wanted yelling.
Oh my gosh, I remember. So they were interviewing for Married to Medicine. There was an episode in Houston, and I remember when they were trying to search for docs, and one of the questions was like, "Hey, do you ever throw anything in the OR? Do people call you a bitch?" And I was like, "Oh God, this is not the right show for me." So they were triaging those type of people, and I was like, "Yeah, God. Probably we're not gonna get along." Yeah.
Oh man, I can just see that. I don't throw scalpels against the wall. That we don't throw shit.
Yeah, exactly.
No. Alrighty, guys. Well, Renee, you did awesome on your first one. Kristi,
thank you.
Awesome as always. It's a pleasure to see you guys. So this is, Renee, Kristi, and myself from the Plastic Surgery Channel. If you want to follow us on YouTube, we do have a channel on YouTube, the Plastic Surgery Channel. And please go to theplasticsurgerychannel.com for further info.